We're visiting with Representative Mark Schauer, who represents Michigan's 7th District, and he's here at the Tecumseh Herald on the heels of the historic passage of the health care reform bill in the House of Representatives. Congressman, would you like to comment on what some have called a historic step toward overhauling the nation's ailing health care system?
Yeah, thank you, Deb and Jim. It's great to be with you guys. It really was historic. Presidents going back to Teddy Roosevelt almost 100 years ago have challenged our country to make sure that everyone could access health care. And many Congresses have failed, and of course the job isn't done yet. But let me put this into context. When I was in Tecumseh back in early July, I convened a roundtable of healthcare providers, business leaders, patients, seniors, mental health advocates, and so forth. And there really was a consensus that our current healthcare system is broken. And I agree with that. People are paying more and more and getting less and less in coverage. In fact, on the House floor on Saturday, on the evening of the vote, I actually talked about that 62% of bankruptcies in this country are due to medical bills. And that's up 50% over the last 6 years. 78% of those family bankruptcies are due to medical bills. So families are struggling, to say the least, with rising healthcare costs. Businesses are struggling under the burden of premiums that keep going up and up and up. In fact, small businesses have seen their premiums go up since the year 2000 by 129%. And you can't talk to a business that really isn't being strangled by those rising healthcare costs. They're having to choose between hiring workers or laying off workers and continuing to be able to pay health care. What I also heard when I was here earlier in the summer in Tecumseh is we have a very inefficient healthcare system that's really focused more on disease and sickness rather than health. And there's a desire to focus on prevention and primary care and making the system work better together. Making sure we're not just paying for the number of services providing, but we're actually paying for quality and paying for outcomes. We talked at this forum in Tecumseh about the number of uninsured. Some of that has to do with people losing jobs, people no longer being able to afford insurance, but it also has to do, in many cases, of people who can't get covered because they have an illness or they've been sick in the past, and their health insurance company now considers them a pre-existing condition. It is a very, very real problem. And another thing we heard was that seniors continue to fall into the prescription drug donut hole, a huge, huge problem. So I listened very carefully in July. We had a bill that had been introduced that went through many changes, and I've been credited by some of my colleagues for really making a difference in this bill to help close the prescription drug donut hole, to help protect seniors so that their prescription drug carrier doesn't arbitrarily change what drugs are covered, to help provide grants for employers that want to start wellness programs for their employees, and making some changes that would affect people's lives right away. For example, ending the practice where women pay 48% more for coverage than men for the same coverage, by allowing parents to keep their young adult children on their coverage until their 27th birthday. There are many, many things, but here's what's important about this bill. It would assure that 96% of Americans would have access to and have good quality comprehensive health care coverage. 96% of the American people. Strong language that would prohibit any undocumented aliens, anyone that's here legally, from being covered. And to bring it close to home, in my congressional district, which includes Tecumseh, 36,000 people that presently can't afford health insurance would be able to afford insurance and would be covered. And that's great news for those families. It's great news for all of us that are paying more to pay for people whose only access to care is the emergency room. It's also good news in reducing health care costs and reducing the federal deficit. I know my constituents are very concerned about spending, and this bill would actually reduce the federal budget deficit by $109 billion over 10 years. So it's important public policy, it's good policy, and I think to demonstrate that, there are a number of groups that are supporting the legislation that the House passed. AARP is one of them, the largest senior citizen advocacy group. The American Medical Association that represents doctors, the American Nurses Association, a group called Consumer Union. They publish consumer reports, and we know that they're looking out for hardworking men and women. They rate cars and toasters. They rate health insurance, and they have determined that this bill will actually be helpful for the American people. The American Cancer Society, because they're very concerned about making sure that the American people can have access to health care screenings to detect cancer early, and make sure that if they have ever been sick before, for example, a woman with breast cancer, that woman would be able to get coverage and wouldn't be just another pre-existing condition. So it was, at the end of the day, it was actually a very easy decision for me to make, because it's not a government takeover, as some might suggest. It's not socialized medicine. It's not a Canadian system or a British system. It really fixes what's broken within our current system. It builds upon what works within our current system, and I'm very pleased that I was part of a group that passed the bill, and hopefully the Senate can do the same pretty quickly.